Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, one on one sessions, and question analysis sessions to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my review videos where I teach on things that we currently do in practice, I will always say that so there's no confusion. With that being said, let's get into question number one for today. As y'all have seen over the past few days, I've been just updating y'all on the things that are currently available. Our practice question course is November the 2nd from 10 a.m. to 11:30 a.m. Eastern Standard Time. During this time, I will break down each exam, the ANCC as well as AAMP, so that you know the blueprint, you know how to approach it, you know what to expect as far as the percentages that they offer in each system area. I will do practice questions live with you guys from each system so that we're able to navigate and work through those together and to give you feedback as we work through. I will show you how to answer each question type as well as provide you with test taking tips. And then also at the end of this, you will receive the questions that we went over as well as the test taking tips. It is $89. It is only 10 people, and I have 4 more spaces available. So if you're looking to join, make sure you click the link in the description to join the course. And as mentioned, antibiotic as well as diabetes worksheets I have designed to help y'all see it all in one worksheet in a chart format. So you're able to quickly identify those medications based off a drug class, how they work, etc. for those antibiotics. And then the diabetes worksheet walks you through those type 2 diabetes, the pre-diabetes, diabetes criteria diagnosis and lab values, the medications in their groups, and contraindications for those as well, just to help you navigate and study a little bit easier. The antibiotic worksheet is $12.99 and the diabetes worksheet is $14.99. Again, all of those are linked in the description. Or you can find the worksheets on my website as well. Also, I have, if you've seen the post in the community portion of this channel, it's our oldest daughter. Lord, our oldest daughter Layla's 13th birthday. Yes, we officially have a teenager, and I don't know that I have wrapped my mind around that yet. But as I always celebrate with my nursing studio family, in honor of her 13th birthday, I have my ebook that is typically $39.99 on sale for $13 for the first 13 people. So grab it while you can. After 13, it locks and you won't be able to get it. So in that ebook, as I always talk about it, it is you'll be able to have it on all devices. It's broken down by systems. It has interactive sections as I talk about with the assessment, diagnosis, evaluation, and treatment, and there's practice questions in the back. So not don't, I was gonna say thank me later, but no, thank Layla in celebration of her birthday. All right, you guys. But that link is in that community section, but I can also add it into the description as well. But let's get into our questions. Question number one: according to GINA guidelines, how often does a patient with well-controlled asthma require follow-up? Is it A, every month, B, every 3 to 6 months, C, annually, or D, as needed? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question as it allows you to slow down to ensure you're answering what's being asked of you. But here, the stem is the question is the stem, right? So it says, according to GINA guidelines, how often does a patient with well controlled asthma require follow up? And the best answer is B, every 3 to 6 months. If it's well controlled, you just keep them on their standard every 3 to 6 month visit cycle, okay? And the thing with asthma, remember, you can step up and step down the stepwise approach, okay? You know, with COPD, it is what it is because it's chronic, right? So it's not going to improve. But with asthma, you can step down if they're having improvement and not warranting the same level of treatment. So if they're well controlled, we reassess every 3 to 6 months, okay? All right, question number 2. The nurse practitioner and MP student are discussing when a referral is warranted for an asthma patient. Which of the following is appropriate for referral according to GINA guidelines? Is it A, if they require a SABA less than once a week? B, if their asthma is uncontrolled despite treatment changes? C, if they have mild intermittent asthma? Or D, after an exacerbation? Take a moment and tell me what you got. All right, so stem of the question here states, which of the following is appropriate for referral according to the GINA guidelines? All right, so when does an asthma patient warrant a pulmonology referral, like referring them to a specialist? And so B is your best answer. If their asthma is uncontrolled despite treatment changes, you want to refer them out and let a specialist manage this. If you have attempted to treat them and then adjust treatments and they're still lacking control of the asthma, we're going to refer out, okay? And then lastly, question number 3, a patient presents to the office today for follow-up. He states that he is doing well, and before leaving, he wanted to discuss exercising again. He states that when he experienced an asthma attack after exercising, he has been afraid to return. What is the best recommendation for exercise-induced asthma? Is it A, use a SABA rescue inhaler before exercise? B, increased ICS? C, with a history of asthma, you will need to continue to refrain from physical activity. Or D, prescribe a LABA. Take a moment and tell me what you got, you guys. All right, so here, stem of the question. What is the best recommendation for exercise induced asthma? Now, that tells you all you need to know right there. But let's just go over the scenario. So, this patient comes in for follow up, but before leaving, he wants to discuss exercising again. He had an asthma attack after exercising previously and has been afraid to return and just looking for some guidance and recommendations. So, for our patients, what do we teach, or what are the guidelines and recommendations based off of the GINA guidelines for exercise-induced asthma? And your best answer is A. We recommend using a SABA rescue inhaler before exercise, at least 15 minutes prior to aid in preventing the exercise-induced asthma as much as possible. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the things that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number 1 at gmail.com. The things that I do offer are my review book. You can get it in a paperback and ebook option. Again, in honor of Layla's 13th birthday, that ebook is $13 while it lasts. And people are going in. So if you wanted it or have been waiting or considering it, here's your chance. Our self-paced review, if you're someone who prefers to study independently, my self-paced review is also linked in the bio of this channel. It's designed for family and adult general for both exams. It includes a non-clinical section. If you need to do practice question, my QBank options are also linked in the bio of this channel. And as always, if you are looking to book a one-on-one session with me, I always say reach out by calling, texting, or email so that we can gauge which one-on-one session really meets the needs that you're looking for. All right, you guys. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.